The nurse enters an examination room to help with an eye examination. The client is directed toward the assessment chart shown below. What is the provider assessing? A. Color vision. B. Depth perception. C. Spatial perception. D. Visual acuity. Answer. A. Color vision. Rationale. This is an Ishihara chart, which is used for assessing color vision. Depth and spatial perception are not typically assessed in a routine vision assessment. Visual acuity is usually tested with a Snellen chart. The nurse has given a community group a presentation on eye health. Which statement by a participant indicates a need for more instruction? A. I always lose my sunglasses, so I don't wear them. B. I have diabetes and get an annual eye exam. C. I will not share my contact solution with others. D. I will wear safety glasses when I mow the lawn. Answer. A. I always lose my sunglasses, so I don't wear them. Rationale. Clients should be taught to protect their eyes from ultraviolet, UV, exposure by consistently wearing sunglasses when outdoors. When tanning in tanning salons, or when working with UV light. The other statements are correct. The nursing student learns that age-related changes affect the eyes and vision. Which changes does this include? Select all that apply. A. Decreased eye muscle tone. B. Development of arcus senilis. C. Increase in far point of near vision. D. Decrease in general color perception. E. Increase in point of near vision. Answer. A. Decreased eye muscle tone. B. Development of arcus senilis. D. Decrease in general color perception. E. Increase in point of near vision. Rationale. Normal age-related changes include decreased eye muscle tone, development of arcus senilis, decreased color perception, and increased point of near vision. The far point of near vision typically decreases. A client's chart indicates anisocoria. For what should the nurse assess? A. Difference in pupil size. B. Draining infection. C. Recent eye trauma. D. Tumor of the eyelid. Answer. A. Difference in pupil size. Rationale. Anisocoria is a noticeable difference in the size of a person's pupils. This is a normal finding in a small percentage of the population. Infection, trauma, and tumors are not related. The nurse is administering eye drops to a client with an infection in the right eye. The drops go in both eyes, and 2 different bottles are used to administer the drops. The nurse accidentally uses the left eye bottle for the right eye. What action by the nurse is best? A. Inform the provider of the issue. B. Obtain a new bottle of eye drops. C. Rinse the client's right eye thoroughly. D. Wipe the left eye bottle with alcohol. Answer. B. Obtain a new bottle of eye drops. Rationale. The nurse has contaminated the clean bottle by using it on the infected eye. The nurse needs to obtain a new bottle of solution to use on the left eye. The other actions are not appropriate. The student learning about vision should remember which facts related to the eyes. Select all that apply. A. Aqueous humor controls intraocular pressure. B. Cones work in low light conditions. C. Glaucoma occurs due to increased pressure in the eye. D. Muscles of the iris control light entering the eye. E. Rods work in low light conditions. Answer. A. Aqueous humor controls intraocular pressure. C. Glaucoma occurs due to increased pressure in the eye. D. Muscles of the iris control light entering the eye. E. Rods work in low light conditions. Rationale. The inflow and outflow of aqueous humor controls the intraocular pressure. Glaucoma results when the pressure is chronically high. Muscles of the iris relax and constrict to control the amount of light entering the eye. Rods work in low light conditions. Cones work in bright light conditions. The nurse reads on a client's chart that the client has exophthalmos. What assessment finding is consistent with this diagnosis? A. Bulging eyes. B. Drooping eyelids. C. Sunken in eyes. D. Yellow sclera. Answer. A. Bulging eyes. Rationale. Exophthalmos is bulging eyes. Drooping eyelids is ptosis. Sunken in eyes is enophthalmos. Yellow sclera indicates jaundice. The nursing student studying the eye learns that which cranial nerves control its functions. Select all that apply. A. Cranial nerves 2B, cranial nerves 3C, cranial nerves 6D, cranial nerves 12E, cranial nerves 10. Answer. A. Cranial nerves 2B, cranial nerves 3C, cranial nerves 6. Rationale. The cranial nerves involved with eye function include cranial nerves 2, cranial nerves 3, cranial nerves 4, cranial nerves 5, cranial nerves 6, cranial nerves 7. A client presents to the emergency department reporting a foreign body in the eye. For what diagnostic testing should the nurse prepare the client? A. Corneal staining. B. Fluorescein angiography. C. Ophthalmoscopy. D. Tonometry. Answer. A. Corneal staining. Rationale. Corneal staining is used when the possibility of eye trauma exists, including a foreign body. Fluorescein angiography is used to assess problems of retinal circulation. Ophthalmoscopy looks at both internal and external eye structures. Tonometry tests the intraocular pressure. A nurse who is applying eye drops to a client holds pressure against the corner of the eye nearest the nose after instilling the drops. The client asks what the nurse is doing. What response by the nurse is best? A. Doing this allows time for absorption. B. I am keeping the drops in the eye. C. This prevents systemic absorption. D. I am stopping you from rubbing your eye. Answer. C. This prevents systemic absorption. Rationale. This technique, called punctal occlusion, prevents eye drops from being absorbed systemically. The other answers are inaccurate.